When people understand what this is, they want it. Whether they want it because they think it's the future, whether they want it because they think it's the pastoral, where you used to have a doctor who just took care of your whole family, which is what my parents were. People are tired of hearing, yeah, we don't cover that, yeah, we don't cover that, sorry, I wanted to do that for you, but my insurance won't let me. So we had a little bit of an unfair advantage because we're starting clean, and so many of the folks out there now have fucked things up so bad.
The economics of healthcare are so busted, you just have to set up your own new economy and issue all the rules, and you can essentially do that on the blockchain. You issue your own currency, you create your own monetary policy, you create your own economic drivers, and it really has the opportunity to revolutionize healthcare.
Our plans are currently 20% cheaper than what a person could buy on the health exchange. So if healthcare costs rise overall, then most payers can make money. So we are looking for ways to realign incentives in the system to drive down prices for our members.
Technology, in my opinion, is only ever an enabler for user benefit. We're not a blockchain startup. We use blockchain and many other technologies to deliver value to patients. And the role of a big incumbent insurance company these days, they're moving money around and they're supposed to be trusted by the people that they serve. They've done a terrible job of the second one, which is why the net promoter score of insurance is worse than anything in this country except Comcast. I literally looked that up. Blockchain is a technology that is really good at moving money around. It removes the requirement to trust these centralized third parties. All you have to trust is math in a transparent system. They don't need to exist anymore. But I fully expect that when we look back on this decade or this century, part of what we'll see is that people got wise and realized we don't have to be reliant on these blood-sucking vampires who take a big-ass cut and have nothing to do with compassionate patient care. If blockchain can help us get there, then great. If Decent can help us get there, then great.
Decent sells affordable health insurance plans for self-employed people. I grew up as the son of two family practice doctors turned medical executives in the Pacific Northwest, and my dad would retire as the chief medical executive of a 650,000 member HMO. And I remember being a kid, like being 8 or 9 years old, and he'd come home and he'd say things to me like, I don't know if my counterparts on the insurance side of our business really care about the patient. I didn't understand what he meant because I was 9 years old, but my parents are my heroes, and so I paid attention.
Yeah.
And this hit really hard. I was the growth lead at a company called Gusto, and I knew I wanted to start my next thing. And so I went as an entrepreneur in residence at a firm called Foundation Capital after Gusto and started working on what that would be, and immediately had to pay more for my health insurance for my family of 4 than for rent in the Bay Area, which is just like, how in the hell is this happening? I dug into it, and I was lucky to have family in the business, so I got to talk to them about what was going on. What's really insidious, and a lot of people don't know about health insurance carriers, is that under current regulation, they take a fixed cut of the total cost of care. What it means is the only way, after a little bit of reducing admin costs, the only way for those companies to make more profit is for the total cost of care to go up, which is not what you'd want as a patient. As a patient, you want the cost of care to go down. So I actually started looking at it as, how could you offer health insurance that's real health insurance to people, that's ACA compliant, that's regulator approved, without having that terrible misaligned incentive where you're actually rooting for the cost to go up over time? And what we found was there's a way to do it by making it easier for people to band together and self-insure using new regulations, just the same way that 90% of American large companies with 500 or more employees have turned to self-insurance because they're saving money versus paying a giant insurance carrier a big cut just to manage their risk. And we're actually launched in the Austin, Texas market, and we have plans that are 20% more affordable in terms of lower premiums on average than market. And they're also comprehensive. They're ACA compliant. And so that's just, it hasn't been possible to do this before. And there's a big kind of why now, I guess, to our business that I get really excited about. I want to build this business because I was self-employed and my health insurance was too expensive. In a very large subset of self-employed people that, if they're just a household of one, for example, make over $50,000 a year and therefore don't qualify for any subsidies. I'm happy to start with those people and try to offer them a better deal, but we ultimately want to serve everybody. What I've told them is, 1 billion covered lives is the goal. And this is just helping all these people self-insure and get a better deal. Here's the deal. These gigantic carriers that are taking a massive cut have historically had two jobs. They've sat there and they've supposed to be a public representation of trust. Oh, you can trust this company you've heard of, so you can give them your money and nothing bad will happen. And then they move money around. And those are the two main things. And what's wild, if you look at the industry, health insurance companies in America have a lower net promoter score than anyone except Comcast. That is a real number. The NPS on these health insurance companies is terrible. And that'll tell you people don't trust these companies anymore. And then you've got new technologies as well as just new technical progress that allows us to get better and better at moving money around, whether that be via tools like blockchain, whether that be via standard API integrations. There's ways to do this where we don't have to rely on these big, I was going to say blood-sucking vampires, but instead I'm just going to say insurance companies. They don't need to exist anymore. Healthcare in the United States, $4 trillion of spend in healthcare every year. 75% of that goes through insurance in one way or another. These are massive companies. The sixth largest health insurance company is a $16 billion company. I mean, just the numbers are sort of insane here. And yet, you don't have certain basic expectations in healthcare like you'd have with any other market. Like, I would expect to be able to see how much something costs before I go to the doctor. There's a tremendous opportunity with blockchain to set that information free, to be able to give people more transparency in what is being spent, on what are the higher value care options. That has some value. The second piece, a lot of the stuff this is good for, it's moving money around in environments of low trust. It's back-end stuff. It's not sexy at all. It's perfect for a boring, primarily back-office industry like insurance. So that's a big piece of what we're doing, whether it's a whole lot of claims management can be adjudicated through smart contracts, or you could really reduce fraud if you had an opportunity to understand the unique identity of the different people you're transacting with. And then the long term, so let's imagine Blue Cross sent you an email tomorrow. They say, hey, we're making some changes. The first change is we're going to open source all of our quality and price data across our provider network, and so you can see basically who's good and how much it costs. And by the second thing is, when you use that information and make cost-efficient health choices, we're just going to send you a little bit of stock in Blue Cross Blue Shield. That's all it's going to be. You can imagine how that might impact your behavior. You could even imagine a world where you go, hey, if I think this mechanism works and it's going to get other people to make the same type of good choices that's going to save the system money and make us all money, I might want to hold on to this stock.
Yep.
And ultimately, there's a way to look at crypto tokens is if you could create a situation where network efficiency benefits everyone directly, straight into their pocket, I think you end up with some of the positive behavior in the crypto community without a lot of the bullshit. And obviously, that's kind of what we're after long-term at Decent too. The reason I guess I chose healthcare as this problem is I do think there's a there in that technology.
Mm-hmm.
And if we aren't real stewards of it, it's going to end up being like every other fintech innovation, which drove more money into the pockets of the already wealthy. And I think there's an opportunity to do a lot more and better here. I can guarantee you, whether it's this year or this decade, change is coming. People are starting to realize we don't need these massive vampiric middlemen sitting on top of our systems of trade anymore. We don't need them charging us an arm and a leg just to manage risk in case our children get sick. What I know that nobody else knows is that these companies don't need to exist anymore at all. It isn't too late to save the world.